Welcome to the Calling All Infection Prevention Nurses First Step for C.Diff NHSN reporting. My name is Karen. I will be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. Please note that this conference is being recorded. I will now turn the call over to Teresa Mandela. Teresa, you may begin.
Well, thank you, Karen. Hello, everyone. I'm Teresa Mandela, an improvement consultant with VHQC. And with me today are Linda Harris, improvement consultant, Sheila McLean, the program director for VHQC, and Sandy Nappick, who many of you have already spoken with, our NHSN coordinator. We ask today that during our time together, you're attentive and engaged, open and collaborative, and actionable. Today's session will be recorded, and you will be emailed instructions on how to access the audio recording from our online community. We'll also be sending you the PowerPoint slides. Registering to use the National Healthcare Safety Network, or NHSN, and then enrolling your facility is a little bit complicated. So do keep in mind that you'll have access to this webinar in the future from the online community. During our presentation, if you'd like to share any thoughts or questions, please use the chat box located to the right of your screen. At the end of the presentation, we will open the phone lines for questions and a question and answer period. At the conclusion, we'll also post evaluation questions. And please take a moment before leaving to complete the evaluation because your feedback is very important and appreciated. First, I would like to give a big shout out to all of the infection prevention nurses and team members on the line today. Some of you may already work closely with us at VHQC, but others may not know what VHQC is. In 2014, VHQC was selected by CMS, Medicare, to serve as the QIN-QIO, Quality Innovation Network, Quality Improvement Organization for both Maryland and Virginia. VHQC's expertise includes knowledge of long-term care, infection prevention, population health management, and building community-based coalitions to reduce readmissions. We bring Medicare beneficiaries, providers like you, and communities together in data-driven initiatives that increase patient safety, make communities healthier, better coordinate post-hospital care, and improve clinical quality. As a reminder, since VHQC is funded by the Centers for Medicare and Medicaid Services, or CMS, we provide education and support at no cost to nursing homes in Virginia and Maryland through the National Quality Improvement Organization, or QIO program. Many of you are already members of the VHQC Nursing Home Improvement Network, and now that includes over 240 nursing homes in Maryland and Virginia. Being a member of the Nursing Home Improvement Network is a little like having an American Express card. Membership has its privileges. For every initiative, you have access to guidance from VHQC's long-term care team and faculty experts. We're pleased to offer education, best practices, QAPI tools, and a data-driven approach to support your facility. So at this point, you're probably saying, hey, wait a minute, am I in the right place? Isn't this webinar about C.Diff reporting? Yep, you're in the right place. Today, we're going to briefly discuss the Prevent C. difficile in Nursing Homes initiative rolled out by CMS, and then we're going to get into the meat, how to get started with registration and enrollment as part of the initiative. The Prevent C. diff in Nursing Homes initiative encompasses antibiotic stewardship, infectious disease communication during care transitions, and in order to measure progress in the initiative, we're starting at the beginning, which is tracking, surveillance, and reporting of C. diff. So sit tight, we'll go over each area, and you may type questions in the chat bar along the way or ask them at the end. A quick review, C. diff is the abbreviation for Clostridium difficile. And you'll often hear epidemiologists and infection preventionists call it CDI, which stands for C. diff infection. The first human case of Clostridium difficile was detected in a child in 1977. What was later understood is that C. diff symptoms were due to two specific endotoxins called A and B, produced by an anaerobic gram-positive bacteria called Clostridium difficile. These toxins bind to the large intestinal wall, causing a pseudomembranous colitis, which is marked by painful diarrhea and inflammation. And a special note to those of us who've been around for a while, like me, today's C. diff is much stronger and more difficult to treat than the cases we saw back in the 80s and 90s. So why should you care about C. diff? And why in the world is CMS, Medicare, so concerned about C. diff? They rolled out an initiative and got your facility involved. Well, the statistics on the screen are rather startling. We're up to 500,000 known cases per year with 15,000 deaths. Worse yet, once you think you've beat it, C. diff returns in at least 1 out of every 5 patients. Our residents who have been on antibiotics recently are far more likely to contract it. And remember, C. diff is generally preventable. So what's going on is that antibiotics kill the normal intestinal flora that serves as protection against C. diff. It's those fluoroquinolones, think Cipro and Levocin and Avalox, that are the antibiotics having a higher chance of causing C. diff infections. But keep in mind that all antibiotics pose some risk. And the newest culprits in the cause of C. diff are proton pump inhibitors like Prilosec and Nexium, Prevacid and Omeprazole. And I know every nursing home on the line has literally hundreds of those pills right now in the med cart. The problem is they're causing an add-on effect to disrupt the intestinal flora. And now at a time when we're all concerned about costs, and now that hospital readmissions from the nursing home are being scrutinized and even penalized, C. diff is a diagnosis with a very high readmission rate to hospital, and it's expensive to treat no matter the setting. It's the deadly symptoms that we have trouble managing in long-term care that can cause readmissions. And according to the CDC, 1 in 11 people aged 65 and older died within a month of a C. diff infection diagnosis. When you look at C. diff deaths overall, 80% of the deaths occurred in folks over age 65. Why do we really focus on that? Because those are the people we take care of. Those are our residents in that age group. Some of you have heard me say this before. When you combine fever with watery diarrhea and copious amounts, with nausea, loss of appetite, and terrible abdominal pain with cramping, you're looking at a very sick, very sad resident in agony. This is an awful way to die, and it's an awful way for family members and staff to watch someone die. So what we know is this. 2/3 of our residents who developed C. diff were recently discharged from the hospital. 1/4 of our residents who have a diagnosis of C. diff once they're in the nursing home go back and are admitted to the hospital. That's a big number. They're crazy high numbers, actually, and we need to pay more attention to them going forward. On top of that, there's the cost of the meds. The recommended drugs are oral vancomycin at around $2,400 per episode, or Difficid at $4,100 per treatment course and up. That's just for the meds. If that resident comes to you for their Med A stay and you have to treat them with those meds, your budget may have just blown up for that month. Important to note is that Flagyl is no longer considered a standard effective treatment for C. diff, according to the Agency for Healthcare Research and Quality, the AHRQ. In March of this year, they reviewed over 50 studies and found that Flagyl, which is a relatively inexpensive drug, should no longer be the standard choice for C. diff treatment. We learned recently from colleagues at Johns Hopkins, for example, that they stopped using Flagyl to treat C. diff over 2 years ago because the C. diff tends to return when using Flagyl or metronidazole. So let's think about what your facility has agreed to do today. I'm going to tell you that your facility rocks because your nursing home has agreed to empower you, those of you on the call, and your team to reduce and prevent C. diff. If I were you, I'd look at this slide and cut out the picture of the super infection prevention person and post it on the door over your name. Why? Because you are about to become a superstar in the fight against C. diff. Today's first step is all about tracking and surveillance. And again, in the coming months, we're going to work with you on antibiotic stewardship, treatment and prevention strategies, innovative hand hygiene work, and communication skills to ensure everybody involved is informed. Your acceptance of this responsibility is a big deal, and we'd really like to thank you for it. To ensure that you're aware of this commitment, the administrator and director of nursing in your facility have signed off on an agreement sent to Medicare that ensures your building will do the following: remain active in this C.Diff initiative through December 2018, participate in the initiative and share best practices and lessons learned, participate in education and NHSN data training sessions, and today is the very first one, enroll your facility in the NHSN and register users with SAMs. We're going to go into that in detail, lucky you, and submit the data to the NHSN monthly through December 2018. Remember also that if you want to select a QAPI project within the Nursing Home Improvement Network, the activities of this C.Diff initiative fit in perfectly if you want to select C.Diff prevention as your QAPI project. Okay, I know. I really do know. This seems like a hassle to do all this reporting, and we don't often have many C.Diff residents in each nursing facility at one time. So why do you have to go through this training and report monthly? Why is CMS making it mandatory in this initiative? Well, I'll tell you. First of all, it's because C.Diff is deadly, and all healthcare providers need to be more aware of antibiotic stewardship and its relationship to C. diff. Also because there are heightened expectations for nursing home infection prevention from the public, from the government, and from your referral partners, the hospitals. It's also because we don't know if we are making any progress whatsoever until we're all using the same metrics and measuring the same way, and because we can't afford the preventable lives lost or the dollar cost of C. diff in nursing homes. By reporting, and frankly, as dull and tedious as it may appear, it's the way we can share information and learn from one another. And lastly, don't lose sight of this. Because of reporting by clinicians like you, some of the biggest advances in medicine have been made from folks who interpreted data from infection preventionists and had an aha moment. Because we're nursing homes, let's never lose sight of the survey process, because that makes us all pay attention. Fortunately, the topic of infection prevention and infection surveillance isn't completely new to nursing home providers. I suspect all of you are familiar with the regulatory guidance developed by CMS for state surveyors evaluating infection control programs as part of the nursing home certification process. These regs address the need for a comprehensive infection control program and cite several CDC guidelines for infection prevention in healthcare settings. The expectation of the regs is that the facility will, quote, perform surveillance and investigation to prevent, to the extent possible, the onset and spread of infection, end quote. So what you're learning to do now, to use the NHSN to track and report, that's part of a robust infection control and program, and prevention program. So now you're like, okay, out of all the people that I work with in my nursing home, how in the world did I get to be the lucky one that leads the initiative in this facility? Well, it makes perfect sense that the person in charge of infection prevention in each building is the chosen one. The CDC's NHSN system calls the infection prevention nurse the NHSN facility administrator. Red alert, red alert. This person is not the nursing home administrator. It's the designated infection prevention nurse in your facility. Let's repeat that. The NHSN facility administrator is not the nursing home administrator. It's the designated infection prevention nurse in your facility. Now, sure, and even on the phone call here, we have in rare instances that could be the same person, but most of the time it's not. In addition to you, the NHSN facility administrator, aka infection prevention nurse, down the road you're going to want to have at least 2 more nurses registered and trained so you can actually take a vacation, have a child, or be out of your building for an extended period. If your facility is part of a chain, the corporate nurse should also be registered and trained. So here's what you're going to be doing for the tracking and reporting portion. You're going to use the NHSN to track infections and analyze infection data. You're going to enroll and report your facility's data into the NHSN. You're going to learn how the NHSN reports can benefit long-term care facilities. For the first time ever in nursing homes, we will be able to benchmark our facilities against the nation and the state, and you're preparing for upcoming SNF infection surveillance regulations. And we're thinking those are going to come out next month. All righty. In case you've been multitasking during this webinar, this is the part where you actually want to start paying close attention. What is the NHSN? We've been throwing around that term quite a lot, and it stands for the National Healthcare Safety Network. It's a system that belongs to the CDC, and it's extremely secure, confidential, and internet-based. Data reported into the NHSN comes from all over the U.S. and some other countries, and it's used for surveillance, benchmarking, and internal quality improvement. This is the system we use to communicate into one single repository everything that's going on related to infections across the nation. Hospitals have used it for several years to report many types of infections, and nursing homes will now start using it to report C.Diff. It all goes back to measuring to see if we're making progress in the right direction. Having the data entered into the NHSN helps the CDC monitor the success of infection prevention efforts. As a long-term care facility, you will begin working with the NHSN now. There is a process of many steps to become registered and enroll your facility, and you must follow these steps exactly. No skipping, no skimping. You will be issued temporary passwords for certain steps, and these expire in 30 days. That means you must keep moving forward and not stop for long periods where you have to start all over again from the beginning. And trust me, you don't want to do that. This registration and enrollment can take anywhere from 2 weeks to 8 weeks, depending on how fast you move and then how fast the CDC moves. Remember, though, you are only reporting C.Diff in this initiative. Do not sign up in the NHSN system to report UTIs, MDROs, which are multi-drug-resistant organisms, or to monitor hand hygiene or gown and glove use. I'm repeating this now. Only sign up for C.Diff reporting in this initiative. There are a couple of you on this call that have hospital affiliations, and you are already tracking the other things. And that's fine if you've already been doing it prior to joining this initiative. But for everyone else on this call, please sign up in the NHSN simply for the C.Diff reporting. You can thank me later. One thing you're going to need to know when you get started is your facility's CCN, or Medicare Certification Number. It's also called a CMS ID by the NHSN. This is not your facility's Med B provider number. It's a CCN or a CMS ID. We sent each of you your CCN number in the welcome email. Maryland CCNs begin with the numbers 215, and Virginia's begin with the numbers 495. If you need your CCN number, please contact us and we will email it to you right away. Our email contact information is at the end of this presentation. For those of you who just signed up this morning, first, relax. 2nd, know you'll be receiving a welcome email very quickly, and you'll even get a training binder over the next 10 days. Okay, so let's talk about getting started. To get started, the first thing you should do is refer to the facility enrollment checklist supplied by the CDC. We've placed one in your binder, and because it's a little overwhelming, VHQC has also created a document called 5 Steps, and you're ready for CDC NHSN reporting. Both the checklist and the 5 Steps document are in your training binders. You can also access the checklist anytime at the cdc.gov web link that's on the right of this slide. This checklist is very cool because in addition to every step, it also tells you the approximate time needed for each step, and it gives you links to hard copy forms. Real quickly, let's go over the 5 steps. First, you're going to complete the enrollment training and preparation presentations. These are both online, presented by the NHSN. You're then going to agree to the NHSN rule of behavior and electronically register the facility. You're going to register with SAMS and submit identity-proofing documents for verification. Don't worry, we're going to go into that in detail. Then you're going to use your SAMS grid card and complete the required NHSN facility enrollment forms and then submit them online. And then the 5th step is that you will complete and sign the agreement to participate and await NHSN activation. So people have asked me, why do I need a SAMS grid card? Well, remember when that couple from Northern Virginia crashed the White House State Dinner? You don't want to be that nursing home person who crashes the CDC's NHSN website. The SAMS grid card gives you clearance to access to very confidential data on your nursing home, and it allows you to see aggregate national and state data as well. In order to do the 5 steps we just went over, there's some moving parts, and we've attached a timeline here. In the 1st to 3rd weeks, you're going to be completing the enrollment training presentations online. You're going to electronically register with SAMS, which stands for Secure Management Access System, submit your identity proofing documents, and then you're going to wait for your SAMS grid card to come in the mail to your home. You're going to use your home address because that's on your identity documents, like your license, so it will come to your house. Depending on how fast the CDC moves, in the 4th to 8th week, you will be receiving your SAMS grid card. You'll complete and submit the required enrollment forms for the facility, and then you'll sign and complete the agreement to participate. That's followed by activation. So no later than the 9th week in this process, you're going to set up the reporting plan for your facility and begin reporting the data. You need to begin now because the drop-dead date for the first reporting is October 31st. Halloween. I wonder if CMS did that for a reason. That's kind of a tricky day, but in any event, you're going to have 9 weeks max to do this whole process. Okay, so before you get a hand cramp from scrambling to write everything down, remember you have all of this information and more in your training binder. If your building signed up before August 8th, you should have the binder already. If you signed up after that, your binder should be on its way to you via FedEx. If you think you should have received your binder by now and you haven't, please email us. Again, the contact information for all of us is at the end of the presentation. In your binder, there are many more detailed slides than we're showing you today. Frankly, just about every step conceivable is in the slides that we put in your binder, and we include hard copy forms and links to webinars that describe the slide decks related to NHSN registration and enrollment. When you get your binders, you'll see tabs 1 through 7 have all the learning sessions that you'll need for everything, registration, enrollment, and reporting. Tabs 8 through 10 have frequently asked questions, tip sheets, very important, tip sheets, and blank forms so you can see what you'll be completing online ahead of time. Let's take a look at step 1. I know this is riveting, but hang with me. I promise it won't be too long. First, you're going to review the checklist. After that, begin the required overview training. Remember, that's a PowerPoint presentation put together by the CDC. After that, you're going to look at another PowerPoint slideshow explaining the SAMS application and enrollment process. That's like getting the White House clearance. That's that part. After viewing the slide presentations, you're going to complete 2 forms that will be required later in the process. And you're going to put them aside. They're called the facility contact form. That's pretty straightforward. And then the long-term facility component annual survey form. Nope, it's not a survey like an inspection. It's asking you questions about your facility, like the number of residents, the type of lab test your lab can provide, etc. One very important thing is that you need to ensure that your computer and your company's computers are prepared to interact with the NHSN. Yep, this is really, really important. You do not want to miss emails that come to you from the CDC, the NHSN, CMS, and of course, those of us at VHQC. There are directions in your binder and also on the NHSN website so that you can ensure your computers are set to the right settings to receive the emails. You may need to ask your IT department to take a look at this, but trust me, it's very simple. It is just a manner of tweaking the settings on your computer. Step 2. That involves logging in and accepting the NHSN Facility Group Administrator Rules of Behavior. You read that and you hit agree to continue. Then you'll go on to register with the NHSN. It's important now, no nicknames. Enter your first and your last name exactly as it appears on your identification documents like your driver's license. You're also going to need to know your facility's CCN number for this step. That's why we want you to have it in advance. You also need to use your exact same email address throughout the entire process. So there's no flipping back and forth between your Gmail and your work and your other personal one. Use the same one from the very beginning all the way through. It's a really smart idea to set up an NHSN folder in your Outlook emails and save all of the NHSN, SAMS, and CDC emails in that folder. Then after you register, hold your contain your excitement, you're going to get 2 separate emails right away. The first one says, welcome to the NHSN. You read that and don't do anything except put it in your saved folder. But then you're going to get one that some people don't read because it says, SAMS, no reply, invitation to register. Well, that's the one that's really important in the beginning. You scroll down the bottom of that SAMS, no reply, invitation to register, and there's a link. There's also a username and a temporary password in that email. And if you don't do that, if you don't click on that link and use those temporary username and passwords right away, they expire in 30 days. You need to do that quickly. When we get to step 3, you've clicked on that SAMS link in that no reply email. You've entered your username and temporary password, and you accept the SAMS rules of behavior. Then you're going to complete the SAMS registration form. Print and complete that application. Find your appropriate photo ID and secondary ID from the list provided in the registration documents. This is just like going to Europe. It's just like dealing with TSA. Confirm your photo ID contains your current home address. Don't pick the one from 2 years ago. Complete the application and take it to a notary public. Often, your business office may have one in your facility and you don't even know it. If that doesn't work, most of the banks that you deal with will have a notary. The notary must endorse the application in more than one place on the form. They're not used to that. Don't let that notary flip to the last page and just sign and stamp it. They actually have to read this and look at the areas in which they are required by law to endorse. Then, once that's done, don't go home and put it aside. You have to act quickly. You want to scan all of those documents. Again, your business office can help you with that. You email the endorsed identity verification form along with the scanned 2 forms of identification, and you send that via email to the CDC Proofing Authority. You can fax it or mail it, But we don't highly recommend that because we all know what happens. Things go hiding when they get faxed or mailed, and they end up in fax or mail purgatory. Once the CDC processes your application, you will receive a SAMS account activation email and a SAMS activity authorization email. All right, keep breathing. When you get these emails, you have completed one of the most difficult parts of this entire process. So I know you. You're bored because now you've done all that. You're waiting for your SAMS grid card to come in the mail to your home address. And being the kind of person that we know you are, you're looking for more things to cross off the checklist. If you haven't already filled out the hard copy form, a long-term care annual facility survey, which remember that's not an inspection but a description, you need to do that now. Please refer to the tip sheet in your binder for assistance. This is going to be extremely helpful when you come across questions that you don't know how to answer. Part of this is that you will need to contact your lab to find out exactly which type of C.Diff test they perform. Wait, you use one more lab and you use more than one lab? Well, you're supposed to contact the primary lab that your facility uses most of the time, not the backup lab. You don't know what kind of C.Diff test they do? Well, the form gives you a list. It could be things like enzyme immunoassay, EAI for toxin, or cell cytotoxicity neutralization assay, or toxigenic culture. Other is also listed there, but don't use it. You need to have the lab select from the options that are descriptive. You may have to speak with the supervisor. The sales rep that you deal with for your lab is probably not going to know the answers to these things off the top of their head. And just when it's super hot outside, still in September, you're going to think, oh, this is like Christmas. I just got my SAMS grid card in the mail. This is a big deal. We even want you to tell us when you get your SAMS card. As a matter of fact, there was someone on the call today that received their card yesterday, and they let us know. So we love you overachievers who've already been working on your binders to do this. Remember when you get that card, it's like White House security. You got to secure it. Not under your keyboard, not out in the open. You need to secure it because you must have the grid card to access the NHSN. It's like your personal little clearance card, so don't lose it. The SAMS grid card is yours. It doesn't belong to the facility. It belongs to you. If you ever leave, you need to make arrangements for the facility to notify the NHSN immediately. You take the SAMS grid card with you. You will use it to re-register if you ever move on to another location, but you will not need to go through this entire registration process again. So remember, it's your SAMS grid card, your username, your password, and they're all linked together. So now you have stuff. You got your SAMS card. You really belong to an elite group in long-term care. So it's time to do what we nurses do best, and let's go back to the checklist. It's time to enter and enroll your facility. This is all under tab 2 in your binder. You will go to Access NHSN Enrollment on the CDC website, use your SAMS grid card to gain entry, and select Enroll a Facility. All right, contain your wild excitement at this point because we're almost to the end of these initial steps. You're going to pull out the 2 forms that you did on paper back in step 1, because you have to complete them online in one sitting during this step. There's no saving it. There's no coming back. The information you have on the forms would be very difficult to keep in your head. So type the information from the written forms into the online forms. You will also enter the CCN number here as the facility identifier. Enter only one identifier and check not applicable for the other identifiers that are listed on the form. Now you see why you need the tip sheet. After submitting the forms online, rapidly, you will receive an NHSN email with a link to the required consent form. This is step 5. The agreement to participate is a 3-page document that requires a form to be filled out on the last page. This document must be signed by you, the long-term care facility's primary NHSN contact person, plus the nursing home administrator. You keep a copy, and then you mail the original 3-page agreement to participate consent form to the CDC NHSN. Within 2 to 3 business days after receiving it, the NHSN facility administrator, that's you, that's not the nursing home administrator, will receive an email notification of activation of the facility from the NHSN. Then what happens? You congratulate yourself. You do a happy dance. You shout hooray, because you are frankly 2/3 of the way there and you've done the most difficult part. There are a few other requirements before you can begin reporting your data, and you will need to begin the setup training, which can be found under tab 3 in your binder. There's also a slide presentation available on the NHSN website as there is for every step of the way. So after all this happens, and now we're talking September, you're going to map your facility in the NHSN system. They're asking about the different units you have in your building. You're going to add users and assign rights. You're going to create your monthly reporting plans, and then you're going to join the VHQC NHSN group. Now, we're going to have session 2 webinar on how to do those things on Wednesday, September 21st at 2 p.m. to walk you through those steps. So please mark your calendars for Wednesday, September 21st at 2 o'clock. Yes, we will send you invitations, but it would be great if you could mark your calendars today. By that time, on September 21st, everyone on this call should have completed the first steps and at the very least, sent in your notarized registration form. Sandy Nappick, who we mentioned earlier, will be there to assist you in every step of the way and will also be monitoring your progress. Today's webinar, along with lots of training materials, will be posted on the VHQC C.Diff online community. You can see how to get there on the screen, but also you can just write this down if you'd like. You go to www.VHQC-QINQIO.NING.com. Again, www.VHQC-QINQIO.NING.com. When you get there, you're going to scroll down and click on the picture tile that reads C.Diff in Nursing Home. You'll see it. It has a photo of hands being washed in the sink. And then you'll see new ? Click here to join. I would suggest you do that. Follow the easy directions to set up an account in our online community. And there's also one for the Nursing Home Improvement Network that I highly suggest you join while you're there on the online community as well. That one focuses more on quality measures. All right, so now you know the steps for registration and initial enrollment. This is frankly the most complicated part of the process, so please don't freak out right now. It does get better and it does get easier, and we know this for a fact because we've worked with infection prevention nurses in hospitals and in some nursing homes that have already joined and have been sending in their data for a couple of years. So once you've registered, you get your SAMS card, you enroll the facility, you set up the reporting plan, and you begin your monthly reporting on the cases of C.Diff that you do or do not have in your building. We know after about the 3rd month, when you get the hang of it, it's only going to take you 5 to 7 minutes per month to submit the report to the CDC via the NHSN. If you're feeling a little overwhelmed after today's incredibly riveting and exciting webinar, I tell you, don't worry. Your facility has made this agreement that you'll do it, and you are joining literally hundreds of folks who have already done it. And I say this to you, If Michael Phelps, who grew up in Maryland with ADD, a struggling single mother, and very limited resources, can win 23 Olympic gold medals, I know you can do this, and you know we're here to help you. Do you remember on that show, Who Wants to Be a Millionaire, you could phone a friend for help if you didn't know the answer to the question? Well, you can email us or call us here at VHQC, and we will work with you to resolve any issues and answer the question. Sandy Nappick, again, with a silent K as the first letter of her last name, is your go-to person for these NHSN questions. And Linda Harris and I are also here to assist. Our contact information is on this slide and also in your binder and also in the welcome emails that you have received. Operator Karen, if you're there, we can now open the line for questions, and you can also submit questions through the chat. Could you also remind the listeners how to ask a question?
Thank you. We will now begin the question and answer session. If you have a question, please press star then one on your touch-tone phone. If you wish to be removed from the queue, please press the pound sign or the hash key. If you're using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then one on your touch-tone phone.
Hi there. Do we have any questions? Do we have any that have come from chat by any chance?
Yes, Teresa, this is Linda. We have one question in chat, and the question is, are hospitals included in this same initiative?
Great question. No, this is a separate initiative strictly for nursing homes. Hospitals have gone through a very similar initiative several years ago. And I know it's hard to believe this, but when hospitals had to join the initiative, the CDC did not have the step-by-step training that we've talked about today. It was kind of fast and loose. You were out there on your own. There were a multitude of terms that were used that were unfamiliar. So I would say the CDC and the NHSN have come a long way, and we have our hospital colleagues to thank for that, for helping them understand that training, that we're all coming from different places. We're working in different types of healthcare facilities, and they really did learn a lot from the hospitals. And they specifically, Dr. Namali Stone at the CDC is a champion for nursing homes and wanted to ensure that nursing homes would have a very specific initiative of their own. Hospitals actually report on a multitude of infections, but it's been decided that nursing homes, since this is so new to all of us, that we will just be reporting initially on C.Diff, and then as time goes on, I could pretty much guarantee you that we will be reporting on other things as regulations change. But for now, this initiative is giving you a head start, and you'll just be doing C.Diff. Do you have any other questions?
We do. We have a few questions in chat. The first one, hang on a second. We just had the evaluation pop up, so I need to get back to chat. Here we go. Okay. This one is, the question is, this individual has not received her binder yet, and she would like to know how long does it take to receive?
It should take approximately 10 to 12 days from the time that we receive your participation agreement. It can be a little faster than that. But we do put the binders together to make sure that they have everything you need, and then we send them FedEx to your attention at your facility. So if you have signed up before August 8th and you've not yet received your binder, if you could email us and let us know, and we will follow up with you immediately to ensure that you get it.
Okay, Teresa, this is Sandy. I just wanted to let you know that we're getting the binders out within 3 to 5 business days.
Yay!
Good.
Thank you.
Okay. All right. This is not a question, but I'm going to read it because I think it needs to be said. This is just a right on no question, but will say I personally spoke to Sandy this morning. Very helpful. Thank you so much. So thank you, Sandy, for all your help.
Yay.
The next question. Are there any posters for antibiotic stewardship? Many families press for antibiotics, and education for them is a big part of this initiative.
Boy, whoever asked that question is already number one ahead of the game, and you hit the nail on the head. I will tell you that for this initiative right now, we're moving in phases, and the very first part is honestly just to get everybody on the same page, register for your SAMS card, enroll your facility, set up the monthly plan, and begin the reporting. After we get all of that done, after Halloween, we will begin in earnest with the learning sessions and offering you a lot of tools and resources for things like antibiotic stewardship and innovative ideas on hand hygiene. So yes, that will be coming. I will tell you in the meantime, if you do go to the cdc.gov and you type in C.Diff or Clostridium difficile, on the left column, there's just unbelievable amounts of resources. And if you click through, you can get to those that are specifically for lay people. Some of you on the call may have noticed if you've gone to your physician offices recently, there are those awesome posters that talk about antibiotic stewardship and not badgering your physician for prescriptions when it's probably a virus. So those are actually available through the CDC for you. Linda and I will actually write that down, and I will try to find the exact link that you can use to access those on your own, because I know many of you on the call are already moving forward with antibiotic stewardship activities, and I think that's fantastic. But rest assured, even if you are moving ahead or if you haven't really gotten deep into the weeds yet, we will be covering that as this initiative moves forward. Any other questions?
Karen, do we have any questions on the line? We do have another question in chat, but maybe we should go to the line first and see if there's anyone there.
Yes, we do have one question. Susan, go ahead. Your line is open.
Hi, Susan. We can't hear you.
I ended up typing the question. I'm the one who asked about that antibiotic stewardship.
You like the multitasking.
Okay, great. Can we ask them, did that answer your question?
Are we good, Susan, with the answer to the question that you sent in? I'm taking that as a yes.
Okay. The next question from chat, are we reporting IHA C.Diff or both community and in-house? Also, when we report monthly, are we reporting ongoing or only new cases for the month?
First of all, I love it when people think ahead. You are way ahead. We actually, in the next session, are going to go over that, and it is in your binder, and very, very clear directions and even examples that are taken, from real nursing homes on what you will be reporting, whether it counts or not as a quote-unquote lab ID event, when you count it, when you don't, whether it's community acquired, whether it's not. All of that we're going to go over in detail moving forward. So rest assured that we will get to that. One of the, and I'm glad you asked this question, because one of the interesting things is that it's no secret out there that hospitals have often said, man, all of the C.Diff comes from the nursing home. And those of us who've worked in nursing homes all of our lives pretty much say, oh, the C.Diff comes from the hospital. So this is an opportunity to really, really carefully track the C.Diff, and not to do it to point fingers at all, because frankly it is an absolute community problem, and we see it everywhere in all settings. but it can be helpful when looking at resources needed to treat that right now, of course, after just a few days in a nursing home, we're putting, a positive C.Diff case as, it's nursing home acquired because they're in the nursing home. However, we're missing that they just recently were recently discharged from another care setting where they may have received a tremendous amount of antibiotics over a long period of time. And so that's very important to know. And part of this initiative will be the training on how those kinds of things get reported. I'd love to tell you immediately that, no, you're not going to have to count it as a nursing home onset. I won't say that, but what I will say is that the reporting will be much more sophisticated than we're used to now, so that it will get down to a level of detail to be able to show the care transitions that a resident has gone through that may have led up to the onset of C.Diff that shows up in a nursing home. I hope that answers the question good enough.
Okay. Let's see. Okay, Sandy just has a response in here too. So there are no more questions in chat at this time. Karen, do you have any other questions on the line?
No questions at this time.
Okay.
Good. Well, thank you all. As you can see, there is an evaluation posted on the right side of your screen, so feel free to go ahead and fill that out. And I am hoping that you will join us again on September 21st as we move into the next phase of this journey. We want to thank you so much for participating in today's webinar, and feel free to email any of us, especially any NHSN questions. Go to Sandy Nappick, and I hope that you all enjoy the rest of your day.
Thank you, ladies and gentlemen. This concludes today's webinar. Thank you for participating. You may now disconnect.